And here to tell us more about this most complex of organs is a neuroscientist and the director of the Hertie Foundation, Dr. Madeja. Welcome to the show. Now, what is early diagnosis actually good for if there is no chance to stop the loss of neurons?
That's absolutely right, but I think it's the first step of treatment. In the first step, we must recognize which neurons are degenerated, and in the second step, we can develop a treatment.
It's the same problem actually with Alzheimer's too, right? There is no early diagnosis, but there is also no therapy.
Yes, of course. We do not have, up to now, we do not have drugs which really stop the degeneration of neurons, and we have to develop them.
If you contract Parkinson's, what is actually the prognosis?
The prognosis for the patients, I think, is I think it has developed in the past years. In a textbook of the year 1982, it was written that the lifespan is reduced by Parkinson's disease. That's not the case in our days. So we are now in a situation where patients with Parkinson have a quite normal lifespan, not reduced, and a situation that they can lead a quite normal life.
You can actually substitute the dopamine that is missing. What else can you do?
Well, that's the first and main step, but we have learned a lot more how we can act with dopamine in a better way. And there's a very new treatment. It's a deep brain stimulation for severe cases of Parkinson's disease. In these cases, we have the chance to give an electrode or to implant an electrode into the brain, and then to tell the brain that that the neurons are still intact just by electric machinery. Sounds
a bit like science fiction, actually.
Yes, it's a bit, but it's a very serious method, and I think it helps a lot, and especially for people with severe forms of Parkinson's disease.
Now, you can actually observe that people in old age can still learn. Does it also mean that they can develop new brain cells, new neurons?
We know that also old people or grown-ups can develop new brain cells, but for learning it's not important. Important is that for learning we have new contacts between the nerve cells, a new wiring, you can say, and that is a process which is the whole life. Which takes the whole life.
An illness like Parkinson's is very dramatic for the patient, but also very interesting for brain researchers like you are. What can you actually learn from that about the functioning of the brain?
I think we can learn a lot because diseases or accidents which destroy parts of the brain, they are something like experiments of the nature. We can see how important this part of the brain is and what happens if this part doesn't function anymore.
So our brain is more or less a compound of different functions which are located at different spots on the brain?
In general, that is right. We have a specialization of several parts of the brain, but for the highest brain functions we have, like thinking, consciousness, etc., we know that we have to use several parts of the brain, especially the cortex, and they have to work together in a way we do not understand.
So, for us humans, with our inevitably limited ways of thinking, with our consciousness, will we ever be able to explain what consciousness really is? Do you think so?
Hard to say. I think from the way of neuroscience, we will find out some ideas or theories what consciousness is. But I think I'm totally convinced that the human being is not only the brain. And if there's something else, of course, we will never find an end in that question.
You're thinking of a soul, for example?
Yes, of course. And we can, from the part of natural neuroscience, we cannot exclude that there's a soul. So it's outside of our understanding.
Thanks a lot for the talk, Madeja.